A global pandemic, a world shutdown, millions of people dying while millions more social distance, wear masks, and fight over the best way to defeat this disease. Now, we're not talking about 2021. We're turning to our past, to 1918, when the Spanish flu ravaged the world. In so many ways, the battles of today were the battles of yesterday. So News 5's Jordan Vandenberg explains why, in some ways, we learned by looking in the mirror of history, and in other ways, we repeated it.
Newspapers are the first drafts of history, and in 1918 there was no shortage of stories to cover. The world was at war, and there was a new enemy to overcome, a strain of the flu virus that would eventually kill at least 50 million people and change public health forever.
It took measures like they did in the 1918 period to bring it under control.
We are experiencing the benefits without seeing what the cost was.
Dr. Amanda Mahoney studies the confluence of history and medicine at Case Western, and Dr. Robert Salata is physician-in-chief at UH, and they say the public health policies of today have roots in 1918.
But it's amazing to see the same measures that were applied during the 1918 time period and what we're faced with now.
In Northeast Ohio, the first warning came on September 22nd, 1918, and the virus quickly spread. In early October, the government took drastic measures, banning public gatherings and closing businesses. But over time, some orders were lifted too early.
It's very similar in that there was a disconnect between what public health officials knew needed to be done, which was a full shutdown and quarantine, and what was possible both economically and culturally to do.
There were stories of public officials violating their own public health orders and of legal challenges filed by churches and restaurants. Experts advocated wearing masks. People made their own. If this sounds familiar, that's because it is. In many respects, history has repeated itself.
One of the great tragedies of the history of health is that we've done all this already. We've learned these lessons, and people forgot about it.
There are lessons to be learned from the pandemics of today and yesteryear, but perhaps chief among them is to not be so quick to forget.
These measures have been proven scientifically time and time again to make a difference. And the decision recently by Texas and Mississippi to stop the mandate for masks, I think, is a mistake.
If newspapers are the first drafts of history, reporters are its authors. And in the earliest days of the pandemic in Northeast Ohio, they noted that whether the public health orders worked depends in large measure upon the people themselves. It was as prophetic back then as it is now. An estimated 675,000 Americans died as a result of the flu pandemic of 1918. As far as the coronavirus is concerned, so far, 500,000 Americans have died, and that number continues to grow. Jordan Vandenberg, News 5.